John, take it away.
Thanks, Liz. And the last hour of talks, in many respects, sets up this discussion. My focus is going to be on improving the quality of OpenNotes implementations. This opening slide is important for my email address at the bottom, because later on I'm going to ask that any of you who are interested in working with us on some opportunities email me. So next slide. So I think it's important to always frame what we're doing with patients in mind. And that includes, I think, children and adolescents. They come first. And we always have to start with that in mind. Next slide. So a year or more ago, we began to wonder what's going on here. As we traveled to places that had implemented OpenNotes, and we asked patients and other folks what was going on, we were surprised. Many of them said, "No one told me I could see notes." Now, Cynthia a few minutes ago said Rady is yet to really market OpenNotes. That's a major issue. Some folks would say, I can't find my notes. And now many of the clinicians would kind of breathe a sigh of relief and say, oh, this has been a non-event. And we thought at first, oh, well, that's good. But then when we started to wonder, well, is anybody actually opening their notes? Because realize in research settings, the study that got this going in 2012 had very high note opening rates. That was one of the reasons why we could be confident that the benefits were substantial and the risks were minimal. So we began to develop concerns that the real world isn't doing things like we thought they would do. Next slide. We began to talk about, well, how do we figure that out? We wondered if qualitative data would help, and we pretty quickly dismissed that when we saw that we couldn't predict things like portal registration rates or the few people who knew how many notes were being opened when they would provide that data. That didn't correlate with any of our impressions of qualitative ways to describe implementation. We did collect information on communication and marketing, and we're kind of surprised. It had a pretty modest impact on note opening rates. We realized we needed to focus on a metric and develop one, and Epic had done some of that same thinking, and we came up with the note opening rate, the numerator and denominator as defined here, a focus on notes, and of course only on the patients who are registered on the portal. They're the only ones who can open their notes. Next slide. Well, we were shocked when 26 organizations were able to report data to us in 2018. We could only get this information from Epic implementers, and only a subset of Epic implementers who, to their credit, were trying to figure out how well was this working. So 24 Epic organizations reported data, and 2 homegrown vendors reported data. And here's what we saw. Only 4 had note opening rates greater than 20%, and the majority were less than 5%. That's surprising. And you saw very low note opening rates at Stanford Children's and Rady because they're in the evolution to a note opening environment. But you can see clearly if we don't do something, not much is going to happen, and the benefits that I think we all are counting on aren't going to be there. Next slide. We also spent some time with vendors. Epic has been terrific to work with. I think they were disappointed to see that folks are having problems opening notes. And they came up with a metric. They also came up with a variety of ways to improve their navigation, which required multiple steps. Many times those steps were not articulated anywhere. And so patients pretty much had to guess how to find their notes if they knew what notes were and if they knew the notes were being shared. So we began to see movement among Epic implementers as they tried the various suggestions that Epic made. and they began to input much more actively to EPIC. In fact, after we circulated our white paper, EPIC had a webinar itself on the topic. I think there were over 120 attendees at the webinar, and the EPIC folks were impressed. My gosh, there's a lot of interest in figuring out how to help people open their notes. With other vendors, we've been struggling, and we're really interested in any input from you all or anyone else in terms of how we can make some progress here. Cerner users can measure patient view rates and downloads, but not note opening rates. So they can get metrics, but the metrics are much more general, and they're dependent on Google Analytics. Now, those metrics even, we see some Cerner programs who are reporting that tens of thousands of patients are viewing a page associated with notes, while other Cerner users are a few thousand a month. So very significant differences, just like in EPIC. And some organizations are trying to figure out Google Analytics, and some are kind of stepping back and, saying, wait a minute, this is Google. From a business security point of view, what are the risks here? And how dependent do we want to be? And what about Cerner figuring this out and helping us do this like EPIC has? With Allscripts and Meditech, their answer has pretty much been simple. We can't separate notes from other documents. They're all in one big file, and we're not going to be able to get to this for quite a while. So some good progress with EPIC, the others not so much. So really what I want to lay out today is, do we have some opportunities that this group would be interested in pursuing with us? The first is we, the California Consortium, would like, our OpenNotes would like the California Consortium to consider helping us do a presentation at the EPIC user group meeting in late August. That application is due in April. We would get that application together. We think this could be a presentation that would focus on improvement strategies. There's many good examples. Stanford on the adult side, for example, has mobile access. And from what they tell us, that has made an incredible impact on folks looking at notes. And Intermountain, who is Cerner, also has mobile access, and they have very impressive numbers. More people are now looking at notes via their phones than they are their desktops. So we're interested in sponsors, participants in a UGM presentation related to how to do this in EPIC. Tentatively, UCSD and Stanford Adult have said that they'd be willing to do that. We're hoping to include patients, Liz, perhaps others who are active EPIC users. The EPIC folks we're working with are very enthusiastic about this presentation. So if there's folks on this call who'd like to be part of that, would love it if you'd let me know. Then we're thinking about, should we organize a Cerner collaborative? Should we try to get Cerner folks talking about the pros and cons of Google Analytics? Is this an opportunity or a risk? Should we try to get Cerner folks to engage Cerner, like really many of our systems have done with EPIC, together? And we have included some Cerner patients who actually are have been very helpful in helping us understand how the patient portal in Cerner works. And then is there an idea that might work to get Allscripts to talk to us more about these metrics? Again, let me end with, if anybody in this group would like to be involved in any of these opportunities or has ideas for others on how we could improve this, email, and if you're willing to, bring it up on the chat or bring it up here in the question and answer session. I'll end there. Thanks for this opportunity, you all.